2020 will be known as a memorable year for Americans and the world. The world faced a grim pandemic that took over 500,000 lives, while exposing the inhumanity of some and the perseverance of many. As 2020 was the end of a decade, it left us with new hope, including vaccines, a new presidency, which elected our first woman vice president of Indian and Jamaican descent. We were also introduced to a valiant woman named Sandra Lindsay, who volunteered to be the first person in the United States to take the COVID-19 vaccine. Though this was an easy decision for her, she knew that by being the first, it would have a bigger impact on those who resembled her and perhaps change the trajectory of their lives as a result. Sandra Lindsay grew up on the island of Jamaica, which is located in the West Indies. Her love for nursing and caring for others stemmed from taking care of her grandmother, who was her primary caregiver. When it was time to pursue her studies, Sandra moved to the United States and enrolled in community college in St. Joseph's College in Brooklyn. She then earned her master's degree from Lehman College in the Bronx. Afterwards, she went on to work at Lenox Hill Hospital in Manhattan and rose through the ranks, becoming the Director of Critical Care Nursing at Northwell Health in 2016. Please welcome Sandra Lindsay. Hi.
Hello, Karleen. Thank you very much for having me. I'm honored to be sitting here with you today.
I'm honored to be sitting with you. I mean, there's a lot going on, so I want to start with congratulations.
Thank you.
It's unique. You are part of a 2022 exhibit for the Smithsonian. And so this card here, your vaccination card, your scrubs, your nursing ID, and the vial which you received your vaccination will be on display. How does it feel?
Surreal. I have had many dreams, but never this one. Never at all this one. But you know, I am so honored to be able to represent healthcare workers in our health system in the United States and around the world who have made such a difference during this pandemic. And this is a tangible link for future generations, for them to know what happened during 2020. So I'm truly honored and humbled to have this privilege.
Let's go back in time a bit, because we just crossed the 1-year mark of when the World Health Organization declared COVID-19, the coronavirus, a pandemic. And if you're like me, or if I'm like you, I hope I'm like you, because you're amazing. You know, when 2020 started, you know, everyone was talking, I don't know if you were saying the same thing, like it was the year of vision, the year of seeing clarity, you know, we're gonna start something big. What was your January 2020 like? What was happening then for you?
So at midnight on January 1st, 2020, I was at a fabulous party in Jamaica. My family and I travel to Jamaica every year to celebrate the new year. And this year we got invited to this party. The host went all out. It was perfect. We're talking ice sculpture with 2020, fantastic music. People were well dressed. The food, the different booths of food, the offering, large variety of food. And at midnight, the skies were lit up with fireworks. Everything about that night and the entire trip was just so perfect. I thought to myself, wow, this was going to be a perfect year, 2020. So just to back up a bit, before I went, my son, I have a son, my only child, is fantastic. He was sick for about a week. Body pains, just feeling completely out of it. No shortness of breath or anything. My mom and I went to Jamaica. He stayed back. About 3 months later, so about in March, he got tested for antibodies, and sure enough, he had antibodies. So he did indeed have COVID.
When you discovered that through the antibody test that he had it, what were your thoughts as a parent and also as a medical professional?
It was scary because then you realize it hit very close to home. He could have died, especially because we weren't testing for COVID at the time. So he could have potentially died. I felt very lucky that, he recovered. But if you ask him now, he said that week was one of the worst weeks of his life because he was in so much pain and agony and not knowing what was going on, except we thought he just really had a bad case of the flu.
So you come back from this amazing trip that I wish I was at, and you come back to work. Did you start to sense something was happening? Was there unusual high numbers of what seemed like the flu? What was that like? Like, what was coming back into work and life feeling like?
So went on the trip. I was following what was happening in China, not that closely before I went. And I thought that, okay, it's only a matter of time through travel that we would see COVID-19 on our American soil. Never thought that it would affect us to the extent that it did. Went on the trip. When I came back in mid-January, I started to follow it even closer as, news was ramping up about really what's happening in China and how are we preparing for if we get hit with this virus here in the US. So really started to follow it, and by February started to get a little scared that, this is really coming here and could really hit us heavily if we're not prepared and positioned to deal with this. On March 7th, we got our first patient in one of our intensive care units at Long Island Jewish Medical Center. And so, started to feel a little bit more frightened, but the staff did a fantastic job. We were meticulous, cautious with ensuring that we isolated this virus to that one room. So we took a lot of preventative measures. And then came the news that the World Health Organization declared it a global pandemic. That was on the 11th. By the 13th of March, I remember vividly that evening when I pulled all the critical care leaders together to say, we need to open up a 5th intensive care unit. We made a plan, and we came back on Saturday the 14th of March, and we opened our 5th intensive care unit. By the time Monday morning came, the 16th of March, came back to work, the ICUs were unrecognizable. It was a whole different place. So many sick patients on ventilators, isolated, staff running around, scared, everybody in personal protective equipment from head to toe. We didn't know what we were dealing with.
So to help the viewer who's watching, normally, so you said you opened up a 5th intensive care unit. So normally, how many intensive care units do you have?
Normally, we have 4 intensive care units with a max capacity of 48 patients.
Okay. And so being proactive, you and your team are like, we're going to do this 5th, and you come back one day later and you're maxed out. It's
a totally different place. And that 5th turned into 10 spaces at the peak of the pandemic. We couldn't keep pace with the volume. The patients, it's almost like we were, I describe it this way, ambushed overnight, with the volume just kept rising and rising, and we just kept expanding and expanding to meet the needs.
What were some of the strategies that you guys used to help alleviate care for some of these patients, and then also for yourselves, like just to make sure that you guys could take on what was happening?
So I have an amazing leadership team of nurse managers and assistant nurse managers. So keeping the communication open. We had to talk regularly, plan ahead, try to envision what will happen and be proactive. Some days we got it, a lot of days we missed the mark. Planning for staffing, ensure that our teams were well taken care of, listening to them, what they needed. That was important. Sometimes we didn't know what to tell them because we didn't know what we were dealing with ourselves. But just being there to support them, to listen, to provide them with what they needed to safely care for patients. So they were, as they heard about personal protective equipment in other health systems being scarce, they were afraid about that. Thankfully, we never run out of PPE. We always had excess, enough for people. So just making sure that they had what they needed to safely provide care and communicating, keeping people abreast of what was going on was very important. Tell you, in the beginning, we were trying to, just do everything ourselves, and maybe it's our way. We were trying to shield people from what was the realities of what was going on and take on some of the burden as leaders. But the staff wanted to know what was going on. And so that was very important to keep those lines of communication. How many patients do we have in the building? How many people are living? How many people are dying? They wanted to know all of that. That helped them to get through this.
How is morale? I mean, as a medical professional, you will encounter people who are sick. You understand that some people will get better. You understand people will not, unfortunately. As you said, this was different from anything any one of us encountered. So how did moral shift or change, or how was it maintained? How did people, because like you said, it's something that you heard about, and you're like, oh, this is different.
So it's definitely challenging, and remains a challenge, as people felt like they didn't do enough. Like their job is to save lives, and they felt like they didn't do enough, especially as they see the data. Over 500,000 people died around in the U.S. They question, did we do enough? In our ICUs, we have amazing outcomes. We're used to seeing people leave our ICUs and not being able to see that, people leaving just in, going to the morgue. That's morally distressing for staff. So they're still dealing with some of that. We had one of our colleagues in our organization at LIJ passed away. So that is family to us. Whether he worked in our division or not, he's part of our LIJ family. So being sad about that, people in our health system that passed away, people in their families, their communities that are no longer there, people are really sad. So morale is taking a hit. So leading during a crisis is a different kind of leadership. You have to be patient, you have to be supportive, you have to listen, you have to be able to hear the harsh feedback and just process it and really not take it personal, but find out what is the underlying message that people are sending.
How did you guys cope?
Some people coped well, some people did not cope well, still are not coping well, still, are sad, out on leave of absence still come to work and occasionally cry. They leaned on each other, mostly. They found creative ways. For example, one of my team, they would have social distance tailgate parties in the parking lot at the end of their shift. that is how they coped with it. Somebody would bring, the snacks and the drinks, and they would spend a half an hour or an hour or so just talking about their day, just decompressing before going home. It worked well for them. People found creative ways. One of the units created a buddy system where they were partnered with a buddy and they would check on each other just to say, hey, how are you doing? I am here for you if you need anything. Just a quick check-in. People, they came up with creative ways, crying together. Unfortunately, due to, the recommendations for social distancing, usually in a break room is where people gather under normal circumstances and just chat and have lunch. So even though we were together in the hospital, people felt isolated because you're not allowed to do those things anymore. Whether you're sitting just two in a room, one in a corner there, one facing the other way. So it can be very isolating, and that also impacted the staff. But I have a creative team. They come up with creative ways to support each other. Mm-hmm. And for us leaders as well, just talking with each other and individually doing what we love outside of work.
At the start of the pandemic, while her team coped creatively and sometimes solemnly about the overwhelming COVID-19 cases they encountered, Sandra was also preparing to welcome her first grandchild. The uncertainty of delivering a child during the COVID-19 pandemic added to her concern. Fortunately, Sandra became a proud grandmother to a healthy baby boy named Avery, who turned 1 in March. So brings me to my next question. How did you cope? I mean, you, Frontlines, you're managing a large team. You're seeing everyone's struggle, work, performance, all these things, their successes. How did you cope personally?
When I would go home and lighting permitted, I would go for long runs. I found that to be very relaxing. Go into my town, sitting by the dock, watching a sunset, and just let my mind wander. During the pandemic, I was also pursuing a doctoral study, which I completed.
Congratulations.
Thank you. So I found doing my schoolwork, as hard as it was, a good distraction, just to think about something else and to, use my brain in some other way besides just thinking about what is happening at work. So it's kind of weird, but it was helpful.
I think a lot of people found really unique ways to cope. I know for me it was bread baking, which I think was the trend on social media, and a lot of knits. So there's a lot of hats for the holidays.
I have to say, I found cooking also relaxing. So I found this book that I like. I cook from a recipe book, especially if it's not my traditional Jamaican recipes. Mm-hmm. And I like plating and decorating. So I would just cook these meals and decorate and plate, and that was very relaxing for me.
Iron Chef here too.
And I must say, Schitt's Creek
really
got me through this, totally. Moira and David, if you are watching, you got me through this, the entire Schitt's Creek cast. I would just go home and laugh and binge watch and laugh and laugh. It made me laugh, and that was helpful.
Laughter does heal.
It sure does.
Do you think people who are not on the front lines, and I say front lines, one of the things you made sure I understood as a whole was that it's not just the nurses and the doctors, it's the people who fed the doctors, it's the people who cleaned up in these rooms, it's the people who had to care for these bodies, to keep them clean. Do you think people understood the gravity and the magnitude of how much frontline workers have done and committed through this pandemic?
I think some do. I think probably most don't. Our communities took very good care of us by sending food, their well wishes, the cards, just everything that they did, showing up at the hospital, clapping us out every evening, just saying thank you to us. They understood what we were going through. We still encountered people who felt like this was a hoax and, it's not as bad as we're saying it is in the hospital, despite seeing images on the news of what was going on. So I felt like it was mixed. Still feel like it is mixed. But what people need to understand is that frontline workers, I had nurses who moved out of their homes because they were scared of bringing the virus home to their loved ones. And they moved out of their homes for months, not being able to see their families. And that is just one of the many sacrifices that people made to save lives. And I don't think that gets through to the masses about how hard, how difficult it was, still is, for frontline workers, essential workers all over. The risk that they put their lives in order to save lives, but staying committed to their job responsibilities, their responsibilities to their organizations, their professional responsibilities. They didn't run away from it. They courageously faced it, left their burdens at the door every day, and came to work.
I think it's important that we share the stories of frontline workers. So we have a few videos that we're going to play so our audience can see and hear the frontline workers and what they've encountered. So here they are.
My name is Shantae Carter. I am a registered nurse and I actually contracted COVID. I had COVID for about 2 months and it was the longest and toughest 2 months of my life. Definitely one of the most scariest times. At some points I felt like I couldn't breathe. Extreme body aches and pain really definitely took a toll on me. It took me a while to recover. So I was sick from about March 17th. I didn't return to work until about May 1st when I finally got a negative COVID test. Having COVID has definitely, I think, affected me mentally because when you're going through or recovering COVID and you're in quarantine and you're isolating, you can definitely have some feelings of anxiety or have feelings of depression, which are some things that I definitely experienced when I was recovering. It definitely took a toll on me mentally, and I'm glad that I'm working my way to be back to 100%. But you always kind of feel like, you always look over your shoulder in a sense, like, could I get COVID again? Am I following every one of the guidelines so that I can stay safe?
Hello, my name is Molly McNamara. During the COVID pandemic, I was a frontline critical care nurse at Long Island Jewish Medical Center. I was fortunate to never contract COVID-19. I like to think that having the proper PPE, an N95, and just being very vigilant about my regimen when I came home, taking off, my scrubs and going right into the shower, very good hand washing, helped me keep my family safe. But it was definitely something that I was nervous about, bringing it home to my family, making them sick. Made me feel very, very anxious. The pandemic and my mental health, there are times or during the first wave that someone will say a story and say, oh no, you were there. And I don't necessarily remember that. I think that maybe I block some of those things out. So I guess that's how I'm coping with things. A lot of my friends have got in contact with a professional mental health counselor, and it has been really helpful for them to process all these different things that we encountered. And it is on my to-do list. I think the hardest part is taking that first step and making the appointment, but it is definitely something that I think is very important to work through for my mental health. Normal pre-pandemic is hard for me to remember. I know that going to work, it was my home away from home. You would go and you would see your friends, and you would work alongside your friends, and you could have lunch with your friends. You know, right now we have a lot of traveler nurses, which many of them have been a godsend to us. They've been so helpful, but you don't see as many familiar faces that you're used to. You never know what unit you're going to be put into. And right when you walk through the door, you get your temperature checked and you have to put a mask on, obviously for safety reasons. And that is going to be around for a long time, I would think. And I don't know if we'll ever be able to feel normal again at work. Always having your guard up, always, in making sure that you're not sitting too close to someone when you're eating your lunch, or, things of that nature.
So we just saw these videos from frontline workers, and there's a lot there. Is this some of what also your team experienced?
Absolutely. These are just, and thank you to these nurses and frontline workers for sharing their stories. These are just a few of the many stories, the many feelings that people are still going through and will continue to go through for a long time. Even when we've gotten COVID under control, we'll be dealing with the lasting effects of COVID for a very, very long time. People still have guilt. People who have had COVID or took home COVID to their families are still feeling guilty about bringing that and what that means, how their family members could have ended up as one of the patients in our intensive care units in our hospital, becoming severely ill and potentially die. That's a huge burden that so many frontline workers are dealing with. And for those who brought it home or felt like they brought it home and their family members suffered as a result of that, that's a guilt that they will be living with for a while. So the effects will be long-lasting.
And what is the best way to support our frontline workers with that? Is it more thank you cards, more, what can we do to help alleviate these long-lasting effects? I mean, definitely do our part for COVID, for sure, but how can we help your team?
Our health system has been doing a lot. It's one of the benefits of being part of such a large, fantastic health system is that they recognize the needs of their human resources and really stand behind supporting the staff and giving the staff what they need to be a healthy workforce. And so we have mental health resources. During the pandemic, we had EAP coordinators on site.
And EAP means?
Employee Assistance Program coordinators were on site to provide staff with real-time care should they need it, acute care. We have a holistic nurse at Long Island Jewish Medical Center. We can call what we call a Team Lavender at any time, where we have a group of experts, including our holistic nurse, chaplains, other leaders who come to our aid when you need it. Anytime you need it, you can call a Code Lavender, and you'll just be surrounded with support to help you go through whatever you're going through. We have a wellness center on site where staff can access. I personally went through a transcendental meditation program that was offered through the health system, and that still helps me today just to maintain clarity, maintain my normal calm, and just make better decisions and be there healthier for my team. So we have a host of resources that staff can access. In addition to that, just listening to people. Listening, active listening is powerful. Sometimes people don't need you to solve any problems. Just to be there and listen and being respectful and acknowledge their feelings as real is very, very important. And being supportive, being there to provide them with whatever they need. One other point I want to make is, in a crisis, all titles is out the door. It's all hands on deck. And that's how we function in our hospital, in our division. I can truly say that at LIJ, we are a team. Everyone comes together. It's not my job, it's everybody's job. And so that's why I want to just really give a shout out to other disciplines within our hospitals that are unsung heroes that really supported the nurses and doctors to be able to do their jobs. So our respiratory therapist, the people who fed us in our cafes, food and nutrition, our housekeepers, who we were turning over those beds so rapidly, I don't know how they kept up. And they're not used to seeing so much death and dying. And they saw all of those things. They can't unsee what they've seen. And yet they came in, personal protective equipment, and worked tirelessly to ensure that we had clean beds to put people in real time to save lives. The persons who brought up our personal protective equipment kept those units stocked. It's so many people. Our security officers who kept us safe. Our concierge people who we didn't have family members coming in anymore, but they coordinated all of the food and donations that were coming in to make sure they fed us. So people just stepped up, and I want everybody to know that it's a team that supported people on the front lines to be able to do their jobs, and so we thank them as well.
We definitely thank them, and you have all the shout outs that we can possibly give. So we definitely will, and we'll make sure that they are honored properly. So let me make sure I have the right, December 14th, December 14th, you did something that I suspect in your lifetime you thought was just a natural part of life. You were vaccinated. But in this case, you were vaccinated with the first vaccine for the COVID-19 pandemic, and you volunteered. Why?
There are several reasons. My professional responsibility to preserve life. Personally, I was scared of getting severely ill and dying. Also, to instill public confidence, particularly in communities of color, that the vaccine is safe and it's our only defense, the best defense against getting severe illness and dying.
In the African American community, we know that there's been some trepidation around the vaccination. And part of you taking the vaccine was, again, public confidence, not only for everyone who saw it, but also for within the community. Why did you feel that it was important to also make that statement for the African American community?
Because I know the hesitancy surrounding trusting the medical community, trusting vaccine. I knew some of the conspiracy theories that were out there to scare people from getting the vaccines. I know about the mistrust, the overall mistrust of governments, medicine, and this goes back to centuries ago from times of slavery where Black people, people of color, were treated inhumanely, unethically, and unfairly.
And what I want to do is really introduce some of the mistrust, the idea of mistrust, where some of it stemmed from, to our audience. So we're going to see a video on African Americans and healthcare right now. America's engagement with African Americans and medicine has a sordid history. African Americans have been subjected to studies or medical experiments that often misled, mistreated, and uncompensated them for the use of their bodies and participation. The Tuskegee experiment in 1932 was a syphilis study that should have lasted 6 months and involved 600 Black men who never received the treatment, free medical exams, meals, and burial insurance they were promised. To make matters worse, the study went on for 40 years with none of them ever being treated for syphilis, despite the availability of penicillin in 1947. Then, in 1951, Henrietta Lacks, an African-American woman who was being treated for cervical cancer, had her biopsied cells used for a study by a hospital researcher without her or her family's consent. Those cells became known as the HeLa cell line, one of the most important cell lines in medical research today. Henrietta's family has never been compensated for their use, despite the hospital taking them without her permission and the impact they've had on medicine. We see that where some of this mistrust has come from, but you trust the science and you did this. What is at stake for the African American community if we don't take this vaccine, if we don't go out and start getting inoculated?
People of color were disproportionately affected 2 to 3 times more than our white counterparts or any other population. If we don't take this vaccine, we run the risk of becoming severely ill or dying from COVID-19.
I don't know what other reason to give besides that. So thank you for taking on this responsibility of being the first to set that tone and that example. I know that as a medical professional, you take an oath, to save lives. And it is, if I may assume, sometimes it's a thankless job, it's a hard job. But could you have imagined that part of your legacy as a medical professional would be taking the vaccine and really showing the public as a whole that it's safe, it's effective, this is what we need to do to move forward as a country, but globally?
Never. I never imagined that. And when I walked into work on December 14th to get vaccinated, I really thought I was going in to get vaccinated, getting this layer of protection that would take some of my personal fears away. I never thought that it would be anything other than that. But I am humbled and honored to have this platform, to be able to reach out to people, share my personal experiences, share what is happening inside the hospitals so that people can understand, share a little bit about how I came to trust the science and made up my mind that this was the right thing to do, that the benefits of taking the vaccine outweigh the risks. So I am truly honored to have the opportunities that I've been afforded to be able to speak to people and inspire people. And, you know, the most rewarding part of this is when people come up to me. Some people recognize me by the voice in this, in outside of work, or by the eyes, where people come up to me, or they text me, or they send me emails, or I've gotten countless fan mails, including from children, who say that I have inspired them, or thank you. I feel like you're doing your part to help us get back to some semblance of normalcy. Just today, one of my colleagues saw me walking into work, and she stopped me to say, thank you so much. You have inspired so many people you don't even know. So that to me is very rewarding. So I would say it's not a bad legacy at all.
Not at all. Not at all. One of the things that we've learned from COVID-19 is that it was kind of like on the spectrum, like it affected people differently. Some people got it and had it severely. Some people had mild symptoms, but overall, obviously affected everyone. What did COVID-19 expose or introduce or highlight about our healthcare system?
It definitely highlighted that we're not doing health very well. Mm-hmm. Although it is erratic. Mm-hmm. There's no rhyme or reason to who gets sick and who lives and who dies. It definitely affected people with comorbidities more. So what it amplifies or highlights is that we need to do a better job with preventative care. We need to do a better job with dealing with social determinants of health. We need to do a better job with equity and access to health care in our communities so that this will not happen again in the future.
What can we do moving forward to prevent something like this from happening and to really protect ourselves in the future?
We have to invest in public health. So all the testing sites and vaccination sites and all the resources we put into the public to deal with the pandemic and get us back on track to normalcy, whatever that means for us. We have to continue those investments after we get a handle on the virus. We have to do a better job with public health. We have to do better community needs assessment. It's not a one-size-fits-all, but to really understand what our communities need and partner with community leaders, influential people in those communities to take better care of our communities. We need to expand access to health care. We need to do a better job of recruiting physicians, healthcare workers who look like the community to serve in those communities, to build that trust in the medical community again. We really need to invest in public health and access. Healthcare should be healthcare is a basic need. It shouldn't be based on where you live or what you look like.
Now that we have vaccines, We have 3 vaccines as of this taping. Are we allowed to take a deep breath and not be as vigilant? Like, does that mean I can, circumvent the 6 feet and go 4 feet? Does that mean that I can go out more? What should we be doing with 3 vaccines? What is proper? Do we have the ability to let go now?
So the first thing is that if you have not been vaccinated yet, you should get vaccinated. And at this point, it doesn't matter which vaccine you get. You should take what is available to you, because all 3 are going to be 100% effective at preventing severe illness and potentially death. Even though they've been studied and have different levels of effectiveness in their respective studies, all of them are going to be effective against preventing severe illness and death. So you should get vaccinated. The other thing you should do is to still continue to follow the CDC guidelines. So maintaining that physical distancing of 6 feet or more, wearing your mask, and meticulous hand hygiene. Don't do large gatherings. Continue to follow the recommendations until the science dictates to us that we can do differently.
So we know that, again, we have passed the 1-year mark, and it has been a hard year for everyone. But I still think there have been some wins. So I want to ask you, what have been some wins for you and some wins for your team?
So when we are able to send people home, when we see our patients, do well, recover even after long hospitalizations. And just today we had one of those wins that made people so happy. So we try to share those with the staff so they see that, we've lost a lot of people, but we've also saved a lot of people. And recently we had a 1-year dedication, remembering those we've lost and remembering the year we've had and all the efforts of everyone. And we did have one of our patients and her husband and baby, who was born during the peak of the pandemic, come back to say thank you. So that's uplifting for the staff. So those are some of the wins that, we celebrate. And we try to emphasize to the staff that you really did a great job. You saved, we lost some, yes, and we're sorry that we did, but you also did a fantastic job of saving so many lives, and you should take credit for that.
So I could spend all day talking to you, and I might just do that. But I have to let you go. But to the person who's watching, what is your final advice to them? What is it that you want them to know?
I want people to know that COVID-19 is not a hoax. It is real. It is still happening. And our best defense against this devastating virus is vaccinations. Getting the vaccines in the arms. That's our best defense against fighting this virus.
Thank you so much for coming and speaking with me and telling your story and sharing the sacrifice and the success of your team. Once again, I want to thank Sandra Lindsay for being here and speaking to me. If you have any questions or comments, please send us an email at the address on your screen. I'm Karleen Leveille. Thanks for watching.